Thank you. Again, just a quick, background. Obviously, my name's Brian Tuttle. I've been doing this a long time, really since 2003, back when the HIPAA security rule came out, which amended the original 1996 HIPAA privacy rule, adding additional regulations relating to electronic protected health information, which is where most protected health information is maintained these days. Probably 95% of it now is electronic versus as it used to be where it was paper, and of course there's also verbal protected health information. But anyway, these laws are in place to protect the civil rights of individuals, meaning your privacy to your health information. Also, the accessibility to your health information and the right to be notified if your health information is breached. And it is the Office for Civil Rights, the Federal Office for Civil Rights, which is part of Health and Human Services, which enforces these laws because, again, it is a federal civil right we all enjoy as Americans to privacy of our health information and access to it, as well as to be notified if a breach occurs. Now, this law has definitely morphed over the years and in a very big way, especially in the area of enforcement. This is no longer something we can ignore, sweep under the rug, because, back then things weren't really being enforced to a great degree. I've also worked in multiple litigated cases as an expert witness being deposed in many different states where this federal law is used. If we are negligent in our federal responsibility, we can be sued under the state laws of negligence or what have you, using the federal violation as the foundation of that state case. This was a very subtle change that occurred in 2013 that's now really starting to rear its head. So this also has personal ramifications. If I do something stupid and go into someone's health record with no business being in it, technically that's illegal and can serve prison time for that. And we'll get into that and how all of that works. And I'll go through some examples of situations and fines and violations as well. And I'll try to keep this obviously more basic than getting into too great detail, as this is more of a beginner's course than an advanced one. So without further ado, let's get started here. So historically, HIPAA it's been around since 1996. It's been on the books, but it wasn't really being enforced to a great degree up until late 2013. That's when enforcement slowly started to happen. The snowball started to go down the hill. And from the political perspective, this is one of the few areas that the right and the left actually agree on up there in Washington, is that more needs to be done to better protect American health information, because historically, healthcare has been a leaking bucket of identity theft, of fraud, of data breach. And we've had no real enforcement of the regulation that was there. And HIPAA is a stout regulation when enforced, but it wasn't being enforced all these years. So a lot of medical practices, groups dealing with health information kind of swept this under the rug, because how often did you hear of a group being audited, fined, or sued, or someone being held accountable for this? Very rarely. That's just not the case anymore. We, being the kangaroo, and the federal government and the trial attorneys, with a little help of Photoshop, being the shark. That's where we stand today. This is no longer something that we can sweep our responsibility under the rug. And I don't want this to be a fear-mongering session, because this stuff's a bunch of common sense, really, when you start looking at it. So now more like a honey badger, very aggressive, very proactively aggressive. We don't have to have a breach to be audited. We don't just have to have a complaint to be audited. We can be audited for bad luck. That's just how it works these days. It is a proactively enforced regulation. And for every dollar they spend on enforcement, they, being the Office for Civil Rights, they bring in roughly 20 in revenue. So it is a revenue generator for them. Again, like a honey badger, very aggressive, very mean. They don't care if you've ever seen the little funny YouTube video about these things, little critters. So personal responsibility. Every single one of us, from the medical board of directors, and later on I'm going to give you an example of a doctor who went to prison because of HIPAA, But everyone from the top of the line, medical board of directors, the top physician, all the way down to the part-time scheduler, we all have skin in the game. And here's how it works. If I go in your health record, just because I'm nosy, I don't need to be in there, go into your electronic health record, just being nosy. I don't disclose it to anybody. I don't sell it. I don't do anything, just being nosy. Technically, that carries up to 1 year and a 1 year in federal prison and a $50,000 fine just for being nosy. If I go into your health record with false pretenses, that carries up to 5 years in federal prison and a $100,000 fine. If I go into your health record and see something and maliciously slander you from what I saw, steal your identity, or maybe it's someone famous, I try to sell it to, say, the Inquirer, that carries up to 10 years and a $250,000 fine. And I've been a part of cases where all 3 tiers have occurred. I've seen this firsthand where individuals do get prosecuted for this stuff. It's serious business. Now, I don't mean accidentally typing in the wrong Jane Doe, in an electronic medical record system. This was more of a deliberate thing. And all of these systems that we use, these electronic health record systems, by law, have to track everything we do. Any system, technically, that stores health information, by law, to be HIPAA compliant, has to track everything that's done in it. So we are responsible for everything that happens under our username. Hence why never share your username and password with anybody else. Those are all responsible for what occurs under our username and password. And by law also, the HIPAA compliance officer at the organization, hospital, practice, whatever it is, has to review these audit logs periodically or on an as-needed basis. So remember, every single thing we do is logged digitally. So yes, there is, of course, personal responsibility for this, and I think everyone understands that, not to go and snoop around in anyone's health information. And this also applies after employment ends. So if I'm no longer employed somewhere and I start telling people about so-and-so's health condition, and that's still illegal. I mean, even when we leave the organization. So privacy, very, very important here. Can we be fined even if a breach doesn't occur? So it's not just about securing and privacy of the information. Patients also have a civil right of access. So hypothetically, if a patient comes in and says, I want my health record, and you say, no, we're not giving it to you because you owe us money. Would be nice if folks paid their bills, but that's still their health record. We have to provide it to them. Now, in this goes state to state to state. You can charge a state-mandated fee, though, to provide someone their health record. Another thing a lot of folks don't realize is, say someone's moved to California and they ask their doctor back east, can you send me my health records? No, we don't have a way to send them secured. I don't care. I want you to email them. I accept the risks. I know it's not secured. I want you to email them to me. We have to send it, even not encrypted, if they accept the risks. It's their health record. We could also be fined if, for example, you have a server that hosts your electronic health record system. The server dies. It gets flooded, struck by lightning, tornado hits it, and the backups are no good. It's not a breach, but we've lost what patients have a civil right of access to. Now, this applies specifically to electronic health records. If you're purely a paper-based organization, different regulations apply. It's not that we don't have to have a, quote, disaster recovery plan in place if we're all paper still. This applies to groups that are under EMR. Because if you're on an EMR, I mean, it's so simple just to back this stuff up. And that's just smart to do no matter what. But we're forgetting about HIPAA for a minute. So definitely, and we could be fined as well if we were audited. And the first thing the government's going to ask is, where is your most recent enterprise-wide risk assessment? Show us your policy for this. Show us your policy for that. If you don't have these things in place, we could be fined for willful neglect and not abiding by what we've been required to do for years. So anyway, it's a lot more than just securing health information. So what is protected health information? And one thing's for sure, protected health information is not created equal. A substance abuse record is protected health information. Very, very sensitive stuff too, versus just a medical record number all by itself. Both are protected health information. One weighs a whole lot more than the other though. So it's patient identifiable health information that's transmitted or maintained in any form or medium. It can be electronic, oral, or paper by a covered entity or its business associates, excluding certain educational and employment records. So if you have employment records, like for HR, that may contain some health information because an employee may have had a procedure for something, that is not covered under HIPAA. But protected health information, the identifiers, and to be completely de-identified, all these identifiers need to be removed. Names, street address, city, county, precinct, zip code, dates directly related to an individual, the birth date, admission date, discharge date, date of death, phone numbers, fax numbers, email addresses, social security numbers, medical record numbers, health plan beneficiary numbers, account numbers, certificate license numbers, even the VIN number on your car or the license plate number, if it's associated with someone's health information, because that is public domain. Device identifiers and serial numbers, web addresses perhaps, IP addresses even perhaps, biometric identifiers like finger and voice prints, and full face photographic images. But again, you have to understand also the nature of the information. The less identifiers, the less sensitive it is, but yet it is still protected health information. So what constitutes a breach? And it's very, very important, if a breach occurs, that we notify the individual or individuals that it occurred. Some of the biggest fines ever doled out have been because a breach occurred and we didn't notify. And by the way, breaches are going to happen. That's understood. This law is not perfect. There's no such thing as perfection under this law. The whole concept of HIPAA is to implement reasonable and appropriate safeguards based upon these specific standards that we go through, and I won't get into all that in a basic course. So if a breach occurs, we need to notify. A breach is any impermissible use or disclosure of health information. It's presumed to be a breach with a requirement to notify the individual unless the covered entity, which would be a provider of care, or their business associate, a 1099 working for the covered entity, like a medical billing company perhaps, if they have to demonstrate that there's a low probability that PHI has been compromised. If you can do that and go through an investigation, then we don't need to notify. But the burden is on us to prove that we did notify or that the breach did not occur. So from a rank and file staff member, just make sure and notify management if something like this happens. And again, not a big deal. It's going to happen. It doesn't even have to be your fault. If the mailman screwed up and took Billy Bob's health information accidentally and delivered it to Tammy Sue, and Tammy Sue opens it up and then lets us know, I accidentally opened this thing up and here's Billy Bob's health information. Well, we need to notify Billy Bob that this happened if we know about it, even though it wasn't our fault at all. So that's kind of how this works, and we need to investigate. You should have some kind of breach incident investigation form, and there's plenty of templates for this online and at the HHS website as well. What was the nature and the extent of the information? What were the identifiers? Was it very, very nominal, or was it some really, really sensitive stuff? Who was the unauthorized person who used the information or to whom the disclosure was made? Did you accidentally fax someone's health record to the wrong doctor's office? Now, that's a breach, but it's very nominal. It's going to another covered entity who's covered under HIPAA anyway for confidentiality, but the individual should still be notified. Was the PHI even acquired or viewed? I mean, if it was if Tammy returns it, didn't open the letter, but returns it to us, it would not be a breach because she didn't open it. To the extent to which the risk has now been mitigated, what are we going to do going forward to lower this risk from happening again to, quote, reasonable and appropriate levels? So it is the Office for Civil Rights that enforces HIPAA. It's part of Health and Human Services. The director of the Office for Civil Rights is a guy named Roger Severino. And he's sort of the main guy in terms of who calls the shots here, the director of OCR under any administration. And real quick about him, I don't need to get into much. A very competent fellow, way smarter than me. JD from Harvard, got a master's degree in public policy from Carnegie Mellon, has a bachelor's degree in business from Southern Cal, where he was a National Merit Scholar, did all sorts of things in the Department of Justice Civil Rights Division, blah, blah, blah. I'm not going to get into all of that. But a lot of folks assume, depending on party in power, that one's less regulatory, one's more regulatory, that this law is being reined in. That's just not the case. As I mentioned, this has always enjoyed bipartisan support, both sides of the aisle. And I want to show you the 4 largest fines of third quarter 2019. Just to put this in perspective, and consider this, from 1996 all the way to 2013, well, really to 2014, the combined total of fines doled out under HIPAA was under $5 million, the combined total. We have individual fines bigger than that now. In fact, one in 2020 was for $9.9 million fines for a great big orthopedic clinic with 25 doctors that was using garbage technology and just unfortunate. We've got to make sure that we dot the I's, cross the T's here. The common denominator with all of these breaches here, or all of these fines, willful neglect. So Presence Health got a $475,000 fine because 836 paper-based operating room schedules went missing. They knew they went missing. They didn't notify. They did not provide those patients their federal civil right of breach notification. They knew it happened. They didn't even have a breach action plan in place. MAPFRE Life Insurance Company of Puerto Rico, $2.2 million fine. 2,209 records were breached because they were put on an unencrypted USB storage device that was stolen. So before I go any further, the second most common way health information is breached in the United States, and sensitive data, period, is loss or theft of a non-encrypted portable device that has health information on it. So there should be no reason at all to ever put any health information on a non-encrypted portable device. Don't do it. Do not do that. If you need to do that, talk to IT and ask them, how can I encrypt this? Either encrypt the laptop or thumb drive or whatever it is, or put that information in an encrypted folder that sits on the portable device. The reason, though, this group got nailed so bad, they had done no risk assessments. However, they had been checking the box every year that they had been doing it and taking federal money. Come to find out, they didn't have any of this. Willful neglect. Children's Medical Center of Dallas, same basic type of thing, bigger fine, $3.2 million, bigger breach, 6,262. Once again, unencrypted portable devices, put health information on there. They failed to implement their risk management plans, contrary to being told to do so. Memorial Healthcare System got the biggest, 5.5 million, 115,000 records were breached, because this is a massive group of thousands of employees. They weren't removing folks as part of their termination procedures. They had terrible termination procedures. They weren't removing folks from the cloud-based electronic medical record system they were using. IT wasn't reviewing the access list periodically to make sure it's accurate. Really high risk when you're a giant organization. If you're a tiny little group with 3 or 4 staff members, that's not a big risk at all. But bottom line, and it's unfortunate because this stuff's not rocket science. This is common sense. And here's the terrifying thing with HIPAA these days. That's what the federal government did. The patients get nothing. So now here come the trial attorneys suing every single one of these guys from the state level. And what legal leg do they really have to stand on? None. They're going to have to cut another check as a judgment for remedy of all these people who had their sensitive data breached due to incompetence. That's the terrifying thing of all this. So just sort of explaining how this stuff is real these days, and that's what happened to the organizations. Of course, individuals also, if we are negligent in what we're supposed to do, it's a personal responsibility regulation also. So with the revenue being brought in from the audit process, the federal government hopes to recoup losses from MIPS, Medicaid, Medicare. So if you're taking federal money, you have a higher risk of being audited here. So back to basics here. Most frequent compliance issues that are investigated: impermissible uses and disclosures of health information, meaning disclosing it, talking about it that we shouldn't be talking about, looking at things we shouldn't be looking at, just being nosy. Lack of safeguards, not securing it appropriately. Lack of allowing a patient access to their health information. Lack of administrative safeguards. What would that mean? That would mean not training the staff, not having good termination procedures, not background checking people when you hire them prior to giving them access to all this sensitive stuff. Use or disclosure of more than the minimum necessary. Now, this is a big one. Minimum necessary applies all across the board. Only speak the minimum necessary, only transmit the minimum necessary. And when you set users up into an EMR system, only set them up based upon the minimum necessary. There was actually a case up in Illinois, University of Illinois, where a new doctor, intern doctor, a young one, was working with a patient who was being treated for a broken leg. There was a bunch of family in the room there with the patient being treated for the broken leg. Well, that new doctor is asking the patient, about the leg, and then starts asking them about how long they've had HIV. That violates the minimum necessary. The family members, yes, they're in there, but that does not constitute the patient's wanting them to hear that information. That's not implied consent. It's implied consent based upon the broken leg information, but not about the HIV information. And now that guy sued them and is very rich. So that would be a violation of minimum necessary from a provider standpoint. Some common HIPAA violations: selecting the wrong person to carbon copy on an email with PHI, selecting the wrong patient name. Now, if you're looking up John Smith and you accidentally type the wrong John Smith, it's not a breach, it's just a common violation. We didn't mean to, it's okay. Selecting the wrong account number, medical record number, or subject ID, entering the wrong supervising or attending physician, sharing information about a patient with others when there's no reason for them to know. That's just being nosy. Failure to report a potential breach or incident to the compliance officer, and improper disposal of materials containing PHI. So a lot of us are working from home. If you do print any kind of health information and it gets scanned into some electronic system, you need to make sure and destroy that through a shredder and not just put that in the normal trash. What if a patient texts you? What if a patient emails you? What if a patient, in a non-compliant way, a patient's texting, asking questions about themselves? Technically, that's implied consent, but you need to let the patient know, that this is not secured. And are you sure you want to communicate that way? So don't just assume. Make sure they understand. I, Brian, understand this isn't secured. I'm cool with it, and that's okay. You can email with patients non-encrypted if they consent. You can text with them non-encrypted if they consent. But you cannot text with each other within your organization unless encrypted. No texting of PHI amongst you guys within your organization unless you encrypt it. And there's plenty of encryption tools out there that are super cheap to accommodate that. Now, what if a patient complies? A patient says, I want you to email me all my stuff. I've moved to San Francisco. I don't care. It's not encrypted. I accept the risks. You send it and it gets intercepted in transmission. Are we responsible? No. We are responsible for making sure we enter the email address in correctly. That goes without saying. But we're not responsible for a disclosure of PHI while in transmission to the individual based upon their access request to receive it in an unsecured manner, assuming they were warned of and accepted the risks associated with that. Very critical. This includes, we don't have to go through the breach notification obligations. There's no liability on our end at all. Plus, and I think everyone knows this, once the patient receives their information, it's certainly not our responsibility at that point. Now, we are responsible for a breach, or to notify under a breach for unsecured transmissions, and we may be liable for impermissible disclosures of PHI that occur in all contexts, except when fulfilling an individual's civil right of access to their health information under HIPAA to receive it or to send it to a third party in an unsecured manner. It's their information. They have all the power. If they want it sent that way, we can send it that way as long as they accept the risks. Can we use email, for example, to communicate within our organization or to another organization and send PHI? This is a slippery slope. Yes, you can email, not text, but email PHI non-encrypted, but if you're doing so, why are you doing so, and what are the identifiers that we're sending? Very, very critical. I could go an hour and a half on just this topic here. If it's very basic, if it's a name and an x-ray of a tooth, that's generally fine to send non-encrypted. Because think of it this way. If it was intercepted, what's somebody going to do with that? Or if it's just a medical record number, if it's intercepted, what's somebody going to do with that? There's no, I mean, you either have to hack your EMR, and it would be very, very difficult. But if it's a name, address, social security number, if it's an HIV record, substance abuse record, mental health record, of course, that stuff should never be sent without encryption. A lot of common sense comes into play here. My opinion is I just would not feel comfortable sending any protected health information without encryption. It's just too much of a slippery slope. But if it's very nominal and that's all you ever send, then it's generally acceptable. Couple things to keep in mind. Employment records, even if they have some health information in there, like HR records, are not covered under HIPAA. Doesn't mean we don't need to secure them, but they're not covered under HIPAA. Education on common cybersecurity threats. So it's impossible to talk about HIPAA and not talk about some cybersecurity threats, because most of the breaches occur based, especially the large ones, based upon technology. And hacking, and also known as social engineering types of tricks, are at an all-time high, especially with COVID-19 and so many people working from home with home computers, many of which are home-based operating systems behind weak firewalls that aren't business level, not having good paid antivirus, a lot of things involved here. Now, one trick that they'll try to do is email spoofing. So these guys are clever, and 99% of this is coming from overseas. Person can look at if these guys can figure out one of the doctors' names, Jane Doe, and figure out, okay, it's Dr. Jane Doe. They're using Athena as their EMR. It's cloud-based. I'm going to spoof Dr. Jane Doe's email, and I'm going to email Tommy. Tommy is a physician's assistant, for example. You would assume Tommy would be a subordinate to the physician. Hey, Tommy, I'm locked out of Athena. Can you provide me your username and password so I can log in? I don't want to bother IT right now, and I'm in a hurry. You know, that sounds pretty reasonable, right? Not like, I mean, some of these are abundantly obvious, but some of these are really clever. If Tommy replies, you're doomed. Massive, massive breach. A few minutes later, you're going to get an email from some creep overseas. having all these screenshots saying, pay me X amount of Bitcoin or I'm going to the World Wide Web with this. So that's not even a virus. That's just a spoofed email. If you ever get a weird email like that, hover your mouse over the name and you can see the origin. So I think most folks understand that. Never, ever transmit your access controls. Never. Cyber attacks, by far the #1 way health records are breached. Not even close. And this is very hard to see, but it's all public domain. Any group that's had a breach of over 500 individuals must be put on what a lot of folks call the wall of shame. And there's hundreds and hundreds of groups on here. What I did is I just sorted by the largest breach ever, and Anthem is still the champ with 78 million records breached. But when you look at how they occurred, hacking/IT incident, loss or theft of non-encrypted portable devices. That's how it occurs. Those are your two biggest risks. So we always want to be cognizant of these technical risks. Ransomware. This is the #1 way health information and sensitive data, period, is breached in the United States. What is ransomware? It comes through email. It comes through those fake emails that look like they come from Microsoft, Apple, PayPal, Bank of America, Walmart, Facebook, you name it. You name it. They're spoofing that type of, they're pretending to be something else to get you to click on a link. They're trying to trick you or entice you to click on a link. You click on a link, it downloads this crypto virology type of malware. What's that mean? What it does is it attacks all your folders on your desktop and it will encrypt them. If you're connected to a network, it will traverse your VPN or your network and attack file shares on your server and encrypt them. It will go after any databases. Like in your EMR, your systems all run on database. It will attack them, it will encrypt them. And the problem is, if that occurs, if this virus attaches to a non-encrypted folder that has health information in it on your desktop, or a non-encrypted file share that has health information on it on a server, or a non-encrypted database, and it attaches to it, that is now a reportable breach. In the old days, I would argue and say, why is that a breach? The bad guy didn't log in to see anything. That argument doesn't work anymore because they've taken possession or control of it. Unless, and this is very important, unless the data is already encrypted. So bottom line is this, I'll just jump to the point. Never put health information on your desktop unless you put it in an encrypted folder. It's easy to do. Never put health information on a server, like on a network, unless it's in an encrypted folder. Never, and make sure the database that you use for your EMR or whatever systems that's storing health information is also encrypted at rest. Is encryption at rest required under HIPAA? No, but you really should be doing this. It's very easy. All we're talking about, an encrypted folder on a desktop, for example, you click on the folder, you have to type a password to get into the folder. That's it. That's all it is. And then all your sensitive documents are inside there. Now, if it's only one document, just an Excel spreadsheet, and that's it that you have on your desktop with PHI in it, you could just encrypt the spreadsheet. That's called file level encryption. So let's talk about some risks for this real quick. Weird emails, watch out for weird emails and watch out for those links embedded in them. Back up your files if you do have health information. 3 backups on 2 different media, 1 in a separate geographic location. Make sure you have the latest and greatest updates, patching, antivirus. By the way, Windows 7 is no longer to be used. It's not supported anymore. You should be using, in my opinion, a business level security suite, not the free stuff. About, $50 a year for a paid version of Norton, McAfee, Viper, whatever you want to use, Ford versus Chevy. It all basically does the same thing. You should definitely let the machine get its latest and greatest updating. In my opinion, also, I would not want to use Windows Home home-based operating systems. If you're using Windows, I would use Windows professional level operating system for two reasons. One, you can hardware encrypt the professional level operating system. Number two, the professional level operating system has a much better firewall and many other security features far superior to the home-based operating system. Costs about $100 more at the time of purchase, but by far a more secure operating system. Access controls. Who are you letting into your systems? It should always be at least 8 characters and complex passwords, not shared. And do you let business partners in? If you let them in and there's 3 people in the business and all 3 need access, all 3 need their own individual logins. Don't go cheap on the technology. Don't use cheap antivirus. Don't use cheap firewalls, especially in a business that's dealing with sensitive data. If you're using really cheap stuff in a business dealing with sensitive data, I've seen this play out, it is not reasonable and appropriate according to the federal government. Avoid unsecured websites. Good physical access controls. Don't leave passwords laying around on sticky notes. Never email your access controls to anybody. Be sure to have a backup copy of your system. Real quick about a social engineering hack, because there's no patch, firewall, update, or antivirus for human stupidity. We're the weak link, and these hackers know that. So it's called phishing, P-H-I-S-H-I-N-G, fake emails that either entice you, trick you to click on a link for identity theft or to download malicious code. And here's one from Facebook. I'm not picking on Facebook, but this one's talking about you've got a copyright problem on your Facebook page. Now this one has a misspell. They misspelled the word below. The goal is for you to click on that link. If you don't, you will be permanently blocked. So this is using a threat to get you to act. And then of course, Facebook is a popular company. So if you click on the link, if you more than likely with a good antivirus, anti-malware program on your desktop, it would block this, it would kill it and squash it. But if you're using some cheap consumer grade basic antivirus, it may not, and it can compromise your system. So be very, very leery of those things. Don't open any weird emails from untrusted sources. Be sure to contact a friend or family member in person or via phone if you ever receive an email message that seems unlike them in any way. Do not give offers from strangers the benefit of the doubt. If they seem too good to be true, they probably are. Lock your laptop whenever you're away from your workstation. And all of us under HIPAA, of course, have personal responsibility. Anything done under our username, anything done under a username is your responsibility. Prevent loss or theft of handheld phones and laptop computers. And absolutely, if you're using a handheld phone, a smartphone, and you're getting email on the smartphone that has health information in it, make sure the smartphone is encrypted with a PIN or biometrics, face recognition, whatever, as long as it's encrypted. And by the way, this goes without saying, forget HIPAA for a minute. If you're not encrypting your smartphone, that's just plain dumb, because there's a whole lot of sensitive information about someone on that smartphone, all kinds of passwords, financial information, statistically far more than if someone was given free reign in your house for an hour and rummaged through your stuff. So always, always encrypt those smartphones, and ideally any laptops or tablets that you use. Now Macs, by the way, a Mac is really easy to encrypt. It comes with built-in encryption, but Windows, you need the professional level. You don't have to encrypt it. It's not required, but if you're ever putting health information on there, I highly recommend doing it. Know where you're sending patient information to. Of course, close programs when not in use. You can always do the Control-L on Windows, and it'll lock the workstation. You don't need necessarily for an electronic medical record system you may be using to have to lock after 5 minutes, but it would be a good idea for your your computer to go to like a password protected screensaver after 5-10 minutes, and then you just type your password in and your EMR is still up, so you don't have to keep logging in and out. That would be very frustrating. Obviously, follow policies. Never, ever post any protected health information on social media, ever. You can certainly have a social media site for your business, absolutely, and you should. It's free advertising, but of course, don't post any health information. Now, you can post information if a patient opts in. You know, a lot of dentists do like teeth whitening, maybe a dermatology group, acne before and after some type of medicine. That type of thing's fine as long as the individual opts in and signs off into it. Do not text protected health information. That is entirely forbidden unless you're texting directly with patient with consent. Ask questions and report any suspicious activity. Personal device use. Bring your own device. So this really is becoming the norm rather than the exception. Folks using their own personal device for accessing, transmitting, and storing protected health information. Is it a HIPAA violation to do so? Not necessarily. It does open up some risks, though, that we need to talk about. Bottom line, do not write protected health information to your mobile device. If there's a reason you need it on there, like a smartphone, you might get email. That's fine. Just make sure the smartphone is encrypted. That way, if it's stolen, no one can do anything with it. And certainly never use a file sharing service on, say, a laptop or anything. That would be like, you know, Napster, like way back in the day, was file sharing, and that's just all kinds of stuff would get exchanged that way, viruses and things of that nature. And when you assess risks, don't forget about personal device use within your organization. So always include the personal device use in risk assessments when you do those sorts of things. Make sure you get that you do the latest and greatest updates, patching, iOSs on smartphones, Windows, Macs, whatever it is. Multi-factor authentication isn't required, and it's kind of it's impossible on some devices, but multi-factor authentication would mean you log into some system like, I don't know, an electronic medical record system, you put your username and password in, then it texts you a code. That's two-factor. That's what we mean by that, and that's not really something you can necessarily do with a personal device. Encrypt the device using whole disk or hardware encryption, because as I mentioned, a lost or stolen encrypted device, even if it has health information on it, is not a reportable breach under HIPAA. USB sticks. This should never be used for long-term storage. If a patient ever asks to put their health information on a USB stick and they hand you a USB stick, never ever plug their USB stick into your machine. If you wanted to provide patients their health information through a USB stick, that's fine, but go to Staples, go to Office Depot and buy a bunch of those things. They're cheap, and you know those are clean. And if you're burning a patient's health information onto a USB stick and you're handing it directly to the patient, you do not need to encrypt it. But if you're burning protected health information like, I don't know, for example, x-rays on a USB stick that you're going to mail to a radiologist, then you would want to encrypt the USB stick and call the doctor or the practice manager and tell them what the password is. And all of these things come with built-in encryption these days. It's very, very, very simple to do. And never for long-term storage. This certainly should not be your disaster recovery plan either. Your number one compliance worry with portable devices, not just personal, but portable devices, is theft. So make sure and encrypt it with a password. With smartphones, you have things that are remote tracking, remote disabling, remote memory wipe. For example, if you have an iPhone and you also have an iPad, this happened to me. Dropped my iPhone in the woods, fell off a four-wheeler, and used my iPad to locate the iPhone. So there's certain things that you can do with another device that's provisioned to follow that. and you can certainly call the vendor and have them memory wipe it as well, Verizon, AT&T, whoever it is, as a last resort. Texting, as I mentioned, we cannot text protected health information, not anymore. You may be scratching your head as to, well, why can we email some nominal health information without encryption, but we can't text it? Because a text transmission, based upon the protocols that are used to send it, is 50 times more likely to be intercepted than an email transmission. So therefore, texting is not considered reasonable and appropriate according to the federal government anymore. I mean, someone could be sitting in your parking lot with what's called a packet sniffer on their laptop, tablet, smartphone, and intercept text all around them. It's not secure unless you use a text encryption program. Email, even unencrypted, is more difficult to intercept. Still can be, but it's just a bit more difficult. We all know what texting is. It's entrenched in medical care. And this is probably the biggest area of non-compliance, I would venture to guess. So a lot of providers ask me, well, how would anybody ever know that we're texting protected health information? Well, I'll give you an example, and this was a case I got dragged into. It was a malpractice case. The doctor, I don't even know what the malpractice was, but the doctor was being sued for malpractice. And as part of any litigation, there's something called discovery. You have to disclose all the emails, text messages, anything that's ever anything to do with this. Oh, well, we're okay. We deleted all those texts. No, Verizon has them. AT&T has them. They have to disclose. They have to turn them over if subpoenaed. So this doctor not only was dealing with the malpractice situation, but now you've got a million HIPAA violations here because he was sending highly sensitive stuff through non-secured texting. So that just opened up another can of worms in terms of that. And it's far too easy just to use a third-party text encryption app. And again, encrypt the smartphone. And by the way, encryption of a smartphone is not the same as encryption in transmission. That's just protecting the phone itself. Has nothing to do with a transmission, the little pin you put on your phone. So any portable device which accesses, transmits, or maintains health information should be encrypted. Any thumb drives, any emails, if they have highly sensitive information leaving the domain, should be encrypted. But if they're not leaving the domain, if it's Brian at drsmith.com emailing Billy at drsmith.com, it's not leaving the domain and would not typically need to be encrypted. Check with your IT on that, though. There can be exceptions. Do not use speaker phones. Now, I know a lot of folks work remotely now, and if no one's in the home, that's fine, but it's not a good idea to use speaker phones when talking with a patient, especially if that patient can tell you're using a speaker phone, because they can file an anonymous complaint with the Office for Civil Rights and we get audited. Always use a headset, something like that. Common sense dictates the point here. And working remotely, working from home, make sure you don't have family members in the same room with you while you're speaking with patients. That your home office should be in an area secured as best as possible. Of course, it's very difficult these days with kids and all being home in many areas, but just the best that we can do here. Quiet voices when speaking to each other within a medical practice or even a home health. Keep it quiet to a degree, best that we can. This is really stupid. Not who was there. HIPAA who? I can't tell you. That's not even funny if you're drunk, I don't think. All right. Couple scenarios. If somebody calls pretending to be a patient and you go through two-factor authentication, typically if someone calls, unless we clearly know it's them, we need to go ideally through two-factor authentication, date of birth and last four of the social. So that person knows that. So this is, I'm calling to pretending to be Joey Smith, and I know the date of birth, I know the last four of the social, and you give me some kind of information, have you committed a crime or a violation? The answer is no. I've committed a felony. That's fraud. Now, yeah, we would need, if we knew this happened, we would need to notify, Joey that this occurred, but we're not the NSA here. This isn't, the CIA or this is intended for reasonable and appropriate safeguards. Reasonable and appropriate safeguards. So that is a felony on my part. The pharmacy calls and informs you that Mr. Smith's calling and pretending to be the doctor in order to obtain narcotics. Can you call other pharmacies and notify them about this fraud? Yes, absolutely, because that is a crime. You can absolutely do that. Using forging prescriptions, doctors, that's a felony. Things to consider. Don't share passwords. We shouldn't have too many administrators in one system. Passwords not being at least 8 characters and complex. You don't really have to change them anymore. They've changed the NIST, who kind of governs, National Institute of Standards and Technologies, who kind of governs HIPAA, says you don't really have to change passwords every 90 days, 180 days anymore unless you just want to. Bad backups, make sure to log off. Financial discussions, if someone can't pay for whatever reason, keep that on the low. Financial discussions are protected health information. What do you do with documents before they get shredded? Don't leave them laying around. Get them in the shred bin. Get them in the shredder itself as quick, if they have PHI, of course. Physical security of systems that host health information. Do you have a server on site? Is it physically secured? Do you have paper health information? Is it physically secured? Are you taking paper off site? If so, is it secured? Put it in the trunk. Don't leave it sitting on the front seat. If you're going in somewhere, it really should be transported A to B. Moving a screen to where folks can't see what's on your screen, where it applies. And I know some of the things you guys do, some of this isn't going to apply, like TV or ambient noise in a lobby or something to help lower the risk of incidental verbal disclosure. Mannerisms, being professional. This is very important. Most people who file HIPAA complaints do it due to a perceived sense of disrespect. So very good customer service, even if some areas are lax, will lower that risk of occurring. Of course, social networking. Never take selfies in an area that has health information. Don't speak about anything on social media about some patient who came in, had this, that, and the other. Keeping voice levels low and to the minimum necessary. Lack of system auditing. Everything we do in a system that maintains health information is audited, or the system's not compliant with HIPAA. Doors to sensitive areas not locked. Encryption not being used. When you let your partners in, if you outsource something, are they coming in through secured means? Are they coming in through individually strict access controls just like anyone else? If you do any remote access, is it secured? Where do you keep historical records? Do you even have any? Where do you keep it? And when you set users up, and when we use systems always based upon the amount of access necessary we need to do the job. Few more cases. So some of these may apply, some of these may not, but at the direction of an insurance company that had requested an independent medical exam of an individual, a private medical practice denied the individual a copy of the medical records. OCR determined that the private practice denied the individual access to the records to which she was entitled under HIPAA. And this wasn't a fine or anything, but among other corrective actions to resolve this issue, OCR required that the practice revise its policies and procedures regarding access requests to reflect the individual's right of access regardless of the payment source. So patients have a right to the information. That wasn't a fine, that was just a slap on the wrist, fix it. A private practice denied an individual access to his records on the basis that a portion of the record was created by a physician not associated with the practice. Among other steps to resolve this issue, OCR required that this practice revise its access policy and procedures to affirm that, consistent with HIPAA standards, patients have access to their record regardless of whether it was created by another physician not associated or provider. So it's their record. If you have it, you have to provide it, even if half of it was from another doctor, if they request it. A lot of folks don't realize that. This one's kind of funny. This was a new Pakistani doctor, but the physician practice requested that patients sign an agreement entitled Consent and Mutual Agreement to Maintain Privacy. Basically, the agreement prohibited the patient from directly or indirectly publishing or airing commentary about the physician, his expertise, and/or treatment in exchange for the physician's compliance with the privacy rule. Big problem. That doctor got a big fine for this, because a patient's rights under their federal civil rights under HIPAA are not contingent on the patient's agreement with the doctor's office or whoever, and cannot be conditioned on their silence. So OCR required them to cease using that and make sure they put in a notice of privacy practices. Any patient going to be seen by a provider, whatever type of provider it is, you provide them with a notice of privacy practices, how your information can be used about you without consent, and how you must consent to it being used. So notice of privacy practices, that's basically the patient's Bill of Rights. This one ended up in a big fine and a litigated settlement. A hospital employee did not observe minimum necessary requirements when she left a phone message with the daughter of a patient that detailed both the mother's medical condition and treatment plan. The employee left the message at the patient's home telephone number, despite the patient's instructions in the medical record and in the consent form to leave it on her work number. So to resolve the issue, the hospital developed new procedures. They did more training, staff training, and all these things, but that was a pretty big breach and caused harm, and the hospital got sued and paid a settlement to that individual and a minor fine to the federal government. This one's really bad. This was a dental office on paper, not electronic. So OCR investigation confirmed allegations that a dental practice flagged some of the medical records, one in particular, with a red sticker with the word AIDS on the outside of the cover, and that records were handled so that other patients and staff, without need to know, could read the sticker. So Billy Bob, here's the name of the patient, AIDS. No one needs to know that but the hygienist and the dentist working on the patient. That should be inside the medical record, not on the outside. So obviously, OCR was notified. The practice immediately removed that. They were fined. They had to pay a settlement to the patient. But and clearly, that's just terrible. Few other scenarios that may or may not apply. So a patient's demanding some kind of prescription, like a pain prescription. Doctor says, you don't need this. No, I'm not going to write you a pain prescription. So the patient says, well, fine, I'm going somewhere else. I want my health records. The doctor cannot deny that patient their health records. So the doctor copies the records herself and gives them to the patient, but the doctor screwed up and gave the patient 3 different records of other patients. So then the patient calls the doctor and says, if you want these records back, write me the prescription. What should the physician do? Of course, not write the prescription, obviously. That would be malpractice almost if that was not in the best treatment. But the doctor needs to put in writing to the individual, I want these records back, and then also notify the 3 individuals that their information has been breached through breach notification. Few things in the news. There was a dermatology group, got a $1 million fine because they put 2,200 records on a non-encrypted thumb drive that was stolen. They didn't notify. Someone blew the whistle. They knew it happened. Someone blew the whistle. And that's how you get these nasty fines. If they had notified, it probably wouldn't have gotten a big fine at all, or any fine. But again, failed to notify. That some employee or physician removed the unencrypted drive from the office, failed to secure it. PHI was transferred to an unsecured flash drive. Risk assessment was never completed. After the discovery, going through how it happened, why it happened, they didn't have policies for this, no training, no risk management plan, no breach management plan, nothing. Here's a doctor that went to prison for HIPAA out of California. I don't know how to pronounce it. Dr. Huping Zhu or Zhao, I don't know. 4 months in prison, fined for HIPAA violation. So he was a licensed cardiothoracic surgeon, immigrated U.S., was employed at the UCLA School of Medicine, of course, in Southern California. He received notice that UCLA intended to dismiss him for his job performance reasons unrelated to the illegal access of the medical records. So while working off the 2 weeks notice or whatever it was, he accessed and read his immediate supervisor's medical records as well as those of other coworkers. That's illegal. He took it a step further. Remember, Southern California, where Hollywood is. So over the next several weeks, while working out this, I don't know how long they gave him before it was terminated, but he went in and looked at high-profile records. Drew Barrymore, Arnold Schwarzenegger, Tom Hanks, Leonardo DiCaprio, to name a few. The system tracks everything we do. It tracked 323 times this dude was going in those records. Now, he wasn't selling their information. He didn't send it to the National Enquirer. He didn't do anything like that. And he admitted that he had done that on 4 specific occasions, but the system spoke otherwise, with no reason, medical or otherwise, after he was terminated. So very, very big deal here. And after he was terminated, so really UCLA, the School of Medicine should also be held accountable for having bad termination procedures. He shouldn't have had any access after he was terminated. I'm not sure where that went, but those individuals, not that these Hollywood people need the money, but they could technically have sued the hospital. Which brings me to suing. So these HIPAA laws, trial attorneys are every bit as dangerous as the federal government if we're negligent. Now, when I say omnibus, that means the 2013 omnibus rule of September 2013, about over 7 years ago now, a very, very small little thing changed. Now, to be clear, there is no profit sharing under the federal law. Patients get nothing. No matter how violated we are as a patient, we get nothing. There's no profit sharing. The federal government's talked about this for years. It's not there. But, so no private cause of action under federal law. We don't have a right to sue based on a violation of HIPAA by itself. What most people don't understand, as nasty as this is and as serious as the penalties are, Congress, in their infinite wisdom, did not ever include a private right of action. But they told Health and Human Services, told all 50 state attorneys general, implement law of remedy. Problem is, if someone's going to sue under their state, the first step they're going to take is file the complaint with the Federal Office for Civil Rights. So we're seeing a mass increase in complaints because that's the first step you take if you're going to sue. When a complaint is filed, the federal government investigates nearly every complaint they get. So what's happening, they investigate the complaint. Federal government says, well, the complaint really didn't turn out the way the individual said, it was kind of frivolous. But while we're at it, show us proof you're complying. Show us your policy for this, that, or the other. Show us your risk assessment. And if we can't provide that, we end up getting deemed for something that had nothing to do with the original complaint. And because that's the first step you have to take in litigation, we're getting a mass amount of complaints. America is a very litigious country. People sue all the time. Go down the interstate and look at the billboards. There's attorneys after attorney after attorney after attorney. So that's one of the problems for this. Why do patients file complaints? Upset with a bill, bad customer service, bad bedside manner, sees their information laying around, overhears too much information by a careless verbal discussion, maybe through a telemedicine session, there's kids walking around in the background, maybe you're talking to them over a speakerphone, a lot of reasons. How to mitigate? Just patients who love the provider, love the folks they're working with are very rarely going to file a complaint. Train staff, train folks who work for you to be, very cognizant of this. Set the practice or your facility or whatever in a strategic manner. And of course, patients are now allowed to sue under their state law, not specifically under HIPAA, but under their state law. Never leave a voicemail for any patient that discloses PHI without express written consent. Never disclose information to any family member unless they're on the authorization form. And there has been, the federal government says that they may call pretending to be somebody, and I haven't ever seen that occur, but I have heard of a few clients out there that think it might have happened. Keep voices low. Limit discussions to the minimum necessary. If you don't really have an office structure typically in this type of what you guys do, but keep windows at best we can to lower risks. Close doors when treating patients, if possible. Discuss financial issues in private area. Limit traffic in clinical areas where applicable in this type of group that you guys work. Escort individuals who aren't part of workforce where applicable. Position terminals so that no one can easily see what's on them. If you use paper, put them in opaque holders so they're not sitting up or anybody who shouldn't see them can see them. Cover schedules if you use those. And again, just if you may be even talking about another patient, and if another patient overhears that, even though it's not about them, you never know. So just be careful about that. Bottom line with all this stuff, with all this HIPAA stuff, it really, in the end, from a rank and file staff member, it's a lot of common sense. Just, make sure that we take reasonable and appropriate precaution here. And there's nothing perfect. It's all about lowering risk to reasonable levels. So covered entities and business associates are expected to follow these standards, implement these policies, procedures, and technologies to reasonably show we're making an effort to lower risks and lower threats and vulnerabilities, protect against that. And with that, I'll open this thing up for Q&A if you guys have any for me.
Okay, Brian, I'm going to make sure that I can unmute everybody. If you, let's see, this may take a second here. I'm unmuting everybody if anybody's got a question, or if you prefer, you can also write in the chat. Brian, we had a question earlier about your slides, and do you share your slides post presentation?
Yeah, I can absolutely. I can send you guys the PowerPoint. You can then distribute them accordingly.
Yeah, that would be great. Okay, I think if you want to ask a question, I've allowed everybody to talk, but you'll have to unmute yourself. I'm not seeing any chat questions yet. Oh, here's a chat question right here. How much does it help? This is from Abby. How much does it help to have a privacy clause at the bottom of your professional email?
It helps a lot, actually. I know that, do people really read those? No, but it does put the stipulation that, this may contain sensitive information intended, just like on a fax. It does help, and I highly encourage doing that.
Okay, thank you.
And it's typically general language as well.
Yeah, I would expect that it's just, just basically, hey, this isn't for anybody but the intended person. Don't look at this.
Yeah. Those do.
I don't see any other questions. And as I said, if you have a question you want to talk, you do have to unmute yourself. I made it, allowed everybody to talk, but you have to unmute yourself. Unfortunately, I am not an expert on Zoom yet.
Nor am I.
Somebody said there's a trick where you can hit your, oh, thank you for the presentation from Leslie. Okay. Someone I heard that you can use your space key to unmute yourself, but I tried that and it didn't work. So, well,
There should be
Brian,
just,
yes, go ahead.
you can push.
I beg your pardon?
That's there should be a mute button you can push as well.
Hi,
Yeah.
I'll say something.
Okay,
Hi.
good.
Sure.
Hi, my name is Carla, and I am a certified care manager working with families regarding aging issues. So, question for you is regarding the encryption programs you mentioned. You said they're not that expensive. Is there anything that you would recommend for a Windows-based encryption program?
You mean just to encrypt like a folder on your desktop?
Yes, we use a case manager database that is HIPAA compliant, that is cloud-based. But for any of our personal files that you were mentioning, don't keep things on your desktop or that could in some way have access to have it in an encrypted folder. And I just would love to hear your opinion on which programs would be.
Gosh, there's so many of them out there. I would just Google Windows folder encryption. In fact, there are a lot of them that are free. All it is you're putting a password. It's just there's if you go to folder encryption, just Google that, Windows folder encryption. There's multiple things listed here. I'm looking at it now, and I hate to say go Google something, but it's really super cheap, and I believe there's free ways to do it as well.
And I believe they're also. I'm sorry, Brian. I know there's also different levels of encryption. There's like, we used to be 28-bit, or now they're up to the 200 and something. So it depends on how secure you want. But I think a lot of, programs like Windows 8, yeah, that's just part of it. You just need to turn it on or off. But I'm not an expert.
You depending on what version of Windows you have, it's built into it, folder level encryption, and it's really easy to do. And it'll tell you just step by step how to do it. If you don't have, and many of your antivirus, if you have a paid security suite, offer that as well in there. And these days, the encryption at rest is typically going to be at minimum 128-bit, but most of it's 256-bit encryption at rest. And you want to make sure the password into it's at least 8 characters and complex. There's tons of it out there. Folder lock, Xcrypt, Crypto Expert. There's just millions of them. It's hard to. They all do the same thing. And I think a lot of the basic version to download is free on many of these because they want to, you to buy the better version. But as long as it's encrypted, it's fine.
And Brian, just another thought I had as well. Everybody on this webinar is, I believe, are ALCA members. MyCare Alliance, we do have IT support, and that's something that's really simple and it's really inexpensive. So we could just ask our IT person about that. Well.
Absolutely.
And he would ask what programs you're using, where exactly you want to do it, and why, and probably in 5 minutes tell you. Here's the best way.
Yeah, and they could probably remote into your machine and do it for you.
Yeah. And
show you how to do it.
Yeah, I don't think somebody has to go out and spend $50 on a program to encrypt when. Yeah. Does anybody else have any other questions?
For any sensitive stuff, your financial stuff, your personal stuff, because that stuff can get compromised too. This is just best practices for anything sensitive.
Any other questions? I guess if not, Brian, it looks like we're good. Let me just check to make sure there's no more chat questions. Nope, there aren't. Great presentation. I always learn from you every time I listen. So I want to thank everybody for being here, and we'll be sending a this recorded presentation to you, a link to it, and then I will Also, make sure everybody gets a copy of the slides. Brian will send those, and we'll send those out as well. So thank you.
All right.
And, Brian, great to hear from you again.
Absolutely. You guys have a great rest of the day.
All right, thanks. Take care.
You too. Bye-bye.